In today's video, we are going to talk about PTSD, post-traumatic stress disorder. PTSD is a mental condition that is triggered by terrifying events. According to DSM-5, PTSD is included in new category, that is trauma and stress-related disorders. All of the conditions included in this classification require exposure to a traumatic or stressful events as a diagnostic criteria. Now we know that for PTSD, any stressful or traumatic event should happen in a person for its diagnosis. So, we will talk about the criteria required for the diagnosis of PTSD. Now, criterion A is stressor. A person was exposed to death, sexual injury, sexual violence in the form of direct or indirect exposure, or a person is witnessing the traumatic events on others, or learning that any traumatic event is happening to the closed ones. Any of these stressors, just one, should be present in a person to diagnose PTSD. Criteria B is intrusion symptoms, in which traumatic event is persistently re-experienced by following ways, that is, unwanted upsetting memories, nightmares, flashbacks, physical reactivity or emotional distress after exposure to traumatic reminders. Any one of these criterion is needed for the diagnosis of PTSD. Now coming towards criteria C, that is avoidance of trauma-related situations after trauma in following ways, like avoiding trauma-related thoughts and feelings or avoiding trauma-related external stimulus. Now moving towards criterion D, that is negative thoughts that begin or worsen after trauma in the following ways. Overly negative thoughts and assumptions about oneself or the world. Inability to recall key features of the trauma. Exaggerated blame of self or others for cause of trauma. Negative affect. Decreased interest in activities. Feeling isolated. Difficulty experiencing positive affect. Among all these negative thoughts, at least two symptoms should be present in a patient to diagnose PTSD. Now talking about criterion E, that is alteration in arousal and reactivity. It can be summed up as inability or aggression, risky or destructive behavior, hypervigilance, heightened subtle reaction, difficulty concentration, difficulty in sleeping. Among these, at least one should be present for diagnosis of PTSD. Now, criterion F, that stands for duration of symptoms, and the symptoms of PTSD should last for more than 1 month. Now talking about criterion G, that has functional significance. Symptoms of this disorder should create distress or functional impairment. Now talking about criterion H, that is symptoms are not due to drugs, medication or substance abuse. The pure cause should be any stressful or traumatic event. Stay tuned with Nursing World and follow me on Instagram with the name of Nursing World 21. And if you are not yet a subscriber, please go and click on the subscriber button. Thank you.